Hello, and welcome to the Pause 2 RCT DOAC Interruption Practice Scenario video. Over the next few minutes, we will be reviewing different DOAC interruption scenarios, starting with the Pause Interruption Protocol and then moving on to the ASRA protocol. Please be reminded of our Pause Interruption Protocol flow diagram. If you have a copy, keep it beside you to help with the following scenarios. A patient taking Pradaxa is having a high-risk surgery Friday morning at 8 a.m. Their creatinine clearance value is found to be 48 mL per minute. How many days of DOAC should this patient skip? 4 days of DOAC. This is because the patient is taking Pradaxa or dabigatran, which is creatinine clearance value dependent, and their creatinine clearance is less than 50. This means the patient's last dose of Pradaxa should be on Sunday night, skipping Monday, Tuesday, Wednesday, Thursday, and having their surgery on Friday morning. A patient taking Eliquis is having a high-risk surgery on Wednesday at noon. Their creatinine clearance value is found to be 72 mL per minute. How many days of DOAC should this patient skip? 2 days of DOAC. This means their last dose of Eliquis should be on Sunday night, skipping Monday, skipping Tuesday, and then having surgery on Wednesday. A patient taking Pradaxa is having a high-risk surgery Thursday morning at 8 a.m. Their creatinine clearance value is found to be 90 mL per minute. How many days of DOAC should this patient skip? 2 days of DOAC. Unlike the first patient taking Pradaxa, this person's creatinine clearance value is greater than 50. This means they only need to skip 2 days of DOAC. Therefore, their last dose of Pradaxa should be on Monday night, skipping Tuesday, Wednesday, and having surgery on Thursday. A patient taking Xarelto is having a high-risk surgery Tuesday at 2. Their creatinine clearance value is found to be 50. How many days of DOAC should this patient skip? 2 days of DOAC. For anybody that's taking Xarelto or Eliquis and following the pause interruption protocol, the creatinine clearance value doesn't change how many days of DOAC that they should be skipping. In this case, they should always be skipping 2 days. This means their last dose of Xarelto should be on Saturday at their usual time, since they're only taking Xarelto once a day. Then they're skipping Sunday, skipping Monday, and having their surgery on Tuesday. So let's move on to the ASRA protocol. Please again be reminded of our ASRA interruption protocol flow diagram, which you may wish to have with you while answering the next few questions. A patient taking Pradaxa is having a high-risk surgery Thursday morning at 8. Their creatinine clearance value is again found to be 48 mL per minute. How many days of DOAC should this patient skip? This patient should be skipping 5 days of DOAC. This is again because they're taking dabigatran, which is creatinine clearance value dependent, and their creatinine clearance is less than 49. Therefore, they should be skipping 5 days. This means that their last dose of Pradaxa should be on Friday night, skipping Saturday, Sunday, Monday, Tuesday, and Wednesday, and having surgery on Thursday morning. A patient taking Xarelto is having a high-risk surgery Wednesday at noon. Their creatinine clearance value is found to be 40 mL per minute. How many days of DOAC should this patient be skipping? 3 days of DOAC. This means that their last dose of Xarelto should be Saturday at their usual time, again because they're only taking Xarelto once a day. This means they'll be skipping Sunday, Monday, Tuesday, and having surgery on Wednesday. A patient taking Pradaxa is having a high-risk surgery Tuesday morning at 10. Their creatinine clearance value is found to be 80. How many days of DOAC should this patient skip? 4 days of DOAC. Again, Pradaxa is creatinine clearance value dependent, and for the ASRA protocol, the middle amount of days to skip, so not 3 and not 5, but 4, goes from 50 to 80. Because this person's creatinine clearance is at 80, they should be skipping 4 days of DOAC. This means the patient's last dose of Pradaxa should be on Thursday night, skipping Friday, Saturday, Sunday, Monday, and having surgery on Tuesday. Finally, a patient taking Eliquis is having a high-risk surgery Friday at 2. Their creatinine clearance value is found to be 50 mL per minute. How many days of DOAC should this patient skip? 3 days of DOAC. For all patients taking Eliquis and Xarelto and following the ASRA protocol, the creatinine clearance value doesn't matter. They should always be skipping 3 days of DOAC. This means the patient's last dose of Eliquis should be on Monday night, skipping Tuesday, Wednesday, Thursday, and having their surgery on Friday. This concludes the pause DOAC interruption practice scenario video. Please take a look at some of our other pause videos, including protocol review and an FAQ, and an introduction to REDCap. Thanks for watching.